This is 7 National News, and in our top story, the Big Heart Foundation has donated $150,000 to support Rohingya refugees in Malaysia, as well as displaced people over in Iraq. The funds donated by the Sharjah-based global humanitarian charity, in line with the vision of Her Highness Sheikha Jawahar bint Mohammed Al Kazmi, the wife of His Highness the ruler of Sharjah and chairperson of the Big Heart Foundation, will be used to help overcome the challenging circumstances and difficult living conditions faced by victims, and will be distributed by the United Nations High Commission for Refugees. It was mentioned that a sum of nearly $82,000, a part of the overall donation, will go towards helping displaced people in Iraq, while $68,000 will be given to assist refugees in Malaysia. Representatives of the Big Heart Foundation were quoted in a newspaper saying that the donation is being given to help inspire optimism and hope in those who have been forced to leave their homes through conflict or persecution, and to share with them the blessings of Eid al-Fitr. Charity officials are hopeful that this effort will be able to support many vulnerable people living under extremely difficult circumstances, while also improving the welfare of refugee children around the world. The Ministry of Health and Prevention has issued 5 circulars warning the public against using a number of dietary supplements. Dr. Hussein Al-Amiri, the Assistant Undersecretary at the Ministry, who's also the Chairman of the Supreme Committee for Pharmaceutical Vigilance, made the announcement, stating that these drugs contain unannounced medicinal substances which cause harmful side effects and that are not registered with the Ministry of Health. The ministry received a warning from the US Food and Drug Administration, or the FDA, not to use the following products: Extra Slim Plus Acai Berry Weight Loss Formula, which contains sibutramine and increases blood pressure; Dream Body Acai Weight Loss and Cleanse, which contains fluoxetine, which can have serious side effects, including suicidal thoughts and abnormal bleeding. The FDA also warned against Dream Body Original Formula, which contains 2 controlled drugs that cause high blood pressure and can be life-threatening for heart disease patients. Al-Amiri called on the public to report such products, as well as for the Ministry of Environment and Climate Change, the Abu Dhabi Food Control Authority, the Federal Customs Authority, and the Food and Health Department of the Dubai Municipality to ensure that the drugs are not being sold or imported into the UAE market. The UAE Federal National Council has announced the passing of a draft law that bans owning exotic animals, which also includes 12 dog breeds, carrying a fine of up to 1 million dirhams. The UAE had banned a total of 12 dog breeds to be owned as pets in the country, primarily due to their aggressive nature and to protect public security. The law was debated in the Federal National Council in May this year and has been approved recently, offering stricter penalties for violating the new ruling. Offenders could face a year of imprisonment and/or up to a fine of 1 million dirhams in fines and penalties. Among the most popular dog breeds included in the new regulations include pit bulls, mastiffs, Rottweilers, German shepherds and Dalmatians, to name a few. Almost all of the 12 illegal dog breeds are considered as likely to show aggression towards strangers or other dogs, along with other dangers if they're not trained properly. Residents are advised to contact their respective Emirates municipalities for complaints and to seek further clarifications on the new rules. The Dubai government has set a new target to make 10% of its civic fleet electric vehicles by 2020, and thousands of cars are being ordered over the next few years. According to reports, an executive electric car committee and a technical electric car committee will report to the Supreme Energy Council and are charged with achieving the target to help slash carbon emissions in Dubai within the next 4 years. Waleed Salman, the Executive Vice President of Strategy and Business Development for DEWA, was quoted saying that they have a target of 16% carbon reduction by 2020. He added that of all the new procurement for vehicles, 10% will go to electric cars, and that in a few years we will see a big difference on Dubai's roads. Salman added that the new committees are working on new ideas to create government incentives to encourage people to buy electric cars, including speaking with the RTA to get free parking for electric vehicles. The Roads and Transport Authority has launched an online selling service in RTA-authorised auto showrooms, allowing buyers and sellers of used cars to finish transactions online. The CEO of the RTA's licensing agency stated that the RTA has provided most of the used car showrooms in Dubai access to its sales transactions system that will reduce the steps required to process a car sale or purchase. The RTA is also calling on other showrooms looking to be authorised to get in touch before the deadline of July the 31st. The CEO added that many of the showrooms have access and the ID card readers that are required to register transactions. Once the Emirates IDs of both the buyer and seller are scanned and the details of the vehicles are entered into the system, a traffic file will be automatically created. The buyer and seller can also send anyone to complete the transaction. Among the key features of the agreement is safeguarding the rights of sellers and buyers and protecting the seller from transferring the vehicle ownership or number plate without their knowledge. The buyer doesn't have to personally visit the registration centre anymore. Just complete the transaction online and hand over the car to the buyer or his representative. It was also mentioned that the RTA may automatically abolish the selling agreement in the case of the expiry of the selling period and if the buyer fails to complete the transaction. Comprehensive police stations at the general headquarters of the Sharjah Police got back about 247 million dirhams to their owners without resorting to lawsuits during the first half of the year. According to a local daily, this was realised through 2,618 complaints lodged with the police stations. It added that the development comes in line with the commitment of the Sharjah Police to protect the society and its interests, as well as achieving the strategic goals of the Ministry of Interior. This is also in line with the Reconciliation is Better initiative that was launched by the Department of Comprehensive Police Stations. The initiative aims to resolve financial disputes through conciliating the disputed parties and allowing defendants in check cases to repay their debts directly to police stations without resorting to judicial authorities. However, the initiative excludes individuals previously convicted. Additionally, Sharjah Police officials stated that the initiative realised 98.644 million dirhams during Q1 of 2016 through 1,322 complaints. This was in addition to 148.88 million dirhams recovered in Q2 through 1,296 complaints. And finally, looking to other news now, in recent years, smartphone healthcare has become a huge business as industry giants such as Apple and Microsoft are facilitating the rapid rise of market demand. Cloud-based services are starting to offer a complete portable medical service, allowing users to book appointments, video conferences with a doctor, order prescriptions, and even view medical results. According to experts, one of the significant benefits of integrating a smart digital strategy into healthcare is the noticeable reduction in cost. Additionally, with the rise in wearables, the cloud service can also receive chart information and store data from Bluetooth-enabled devices. From blood pressure to oxygen in the blood to lung function, smartphones can highlight a multitude of things about a patient's health and also monitor these trends over time, offering data to healthcare practitioners that they've never had access to before. Experts also say that one of the major areas where healthcare brands can evolve using smartphone devices is filling in the void for healthcare staff. Smart devices provide an alternative means of communicating with colleagues. Staff can also access the internet, use a healthcare app to find information on certain ailments, and communicate with patients across a multitude of channels, whether in person or virtually. Logistically, smart devices also help patients navigate hospitals, receive reminders from their physicians, and also help monitor their health. Moreover, using data to diagnose common medical problems, a smart device can then be used to warn patients of certain symptoms, such as a heart attack, well before they become severe.
What we're seeing right now is like a lot of like smart devices coming on the market. So people are wearing more and more wristbands, and we have devices that are not just like consumer devices, but also devices that you get prescribed from doctors and like other facilities. And what's happening is that like the whole platform that we had before is changing for like an disconnected platform that works with like mobile applications, measuring devices, and like that are integrated together in this like Internet of Things that enables to track data in a completely different and new way. And that brings a lot of new opportunities to the market. And then, of course, there is like a whole cost saving around it as well, because like this kind of technology enables us to have like better research, because we can like get data more easily, and it also helps to make processes more efficient. What we've seen now is like quite interesting that like, of course, like it's for the younger segment because they have the devices already and they're used to them. But companies are investing in technology that are also catered to like older people. For example, medication dispensers that like remind older people to take their medication regularly. They like send alarms if they don't do it. They're like connected to their smartphone or even to their children's smartphone and tell them that their parents are not taking the medication. So I think there is a lot of opportunity for like all ages, and it's not just something for the younger generation.